The Naughton Protocol is a submaximal exercise test used to identify and confirm CAD in a patient. It has incremental increases in workload that are more gradual than the Bruce protocol, making it a great option to use for patients who have a debilitating disease such as heart failure. Testing is also performed for individuals on a transplant list to determine their prognosis and how well they will take that transplant. There are several different stages, each one slightly more intense than the last. Your heart rate gradually increases throughout the test with an endpoint target zone that is 80 to 90% of your maximum heart rate. For example, our patient's age predicted max heart rate is 196, so we would want him to exercise at a heart rate between 156 to 176 beats per minute. As the patient walks on a treadmill, ECG sensors are attached to his chest to measure their heart's electrical activity, and vitals are monitored throughout. The ECG sensors record the heart's rhythms and activity as the patient performs that test, which can confirm rhythm abnormalities and other heart conditions such as ischemia.
Absolute indications for terminating an exercise test include ST elevation in leads without pre-existing QAs because of prior MI, drop in systolic blood pressure of greater than 10 millimeters of mercury despite an increase in workload when accompanied by other evidence of ischemia, moderate to severe angina, central nervous system symptoms, signs of poor perfusion, sustained ventricular tachycardia or other arrhythmia, including second or third degree AV block that interferes with normal maintenance of cardiac output during exercise, technical difficulties monitoring the ECG or systolic blood pressure, or the subject's request to stop. Relative indications for terminating an exercise test include marked ST displacement, drop in systolic blood pressure of greater than 10 millimeters of mercury despite an increase in workload in the absence of other evidence of ischemia, increasing chest pain, fatigue, shortness of breath, wheezing, leg cramps, or claudication, arrhythmias other than sustained ventricular tachycardia that have the potential to become more complex or interfere with hemodynamic stability, exaggerated hypertensive response with systolic blood pressure greater than 250 millimeters of mercury or diastolic blood pressure of greater than 115 millimeters of mercury, development of a bundle branch block that cannot be distinguished from ventricular tachycardia, or SpO2 less than or equal to 80%.
The stopwatch is started when the test is started to measure the total amount of time that passes until the subject is exhausted. The test proceeds until the subject reaches volitional exhaustion, maximum heart rate, a VO2 plateau, or an RER of 1.15 or greater. The stopwatch is then stopped when the subject can no longer continue.
The Borg RPE scale can be used to monitor fatigue throughout the exercise test, and vitals should be monitored before and after.
All right, so we're just doing the Naughton Protocol today. So we are having you walk at 1 mile per hour, and then we're doing this for 2 minutes. This is just the warm-up, and then we'll get into the stages for the test. All right, so now we're at 1.2 for the speed, and we're gonna do this for 2 minutes. The incline is still at 0. So for this, we're at 1.5 speed, and still 0 incline. You're gonna do this for another 2 minutes. All right, so for stage 3, we're at a 3 incline, still at 1.5 speed, and another 2 minutes. Okay, stage 4, we're still at 1.5 speed, but this time we're at a 6 for incline, and another 2 minutes. Stage 5, we're at 9 incline, the speed still remains the same, and still another 2 minutes. Okay, so we're in stage 6, the last stage. You're at 12 incline, and we bumped up the speed to 2 miles per hour. And do this for another 2 minutes.